Hi, everyone. Welcome to Provider Spotlight. We are back this week. We are here telling all the very unique stories of different private practices and healthcare practices. This week, we have Sue Nordemo of Monarch Health Coaching in Nashua, New Hampshire. She is an RN and has an associate's degree in social work. She is also certified health coach, instructor for hypnosis, very interesting, certified in pain management, anger management, smoking cessation, bariatric surgery for the mind, and certified in hypno coaching. Sue, you are a busy woman.
Yeah, you
Welcome.
could say that.
Welcome to the show. We're happy to have you.
Thank you. It's so good to be here today.
Yeah, we are excited. So let's dive in. So tell us, how did you get into your specialty or the many specialties that you have?
Well, I've been practicing Reiki for years, okay, but I was still smoking. I was up to almost 2 packs of cigarettes a day. I picked it up in 1965 when I went into nursing school, of course. And so I was doing visiting nurse work. I'll keep this story short, but it's very important. And I got assigned to this gentleman who had had a double lung heart transplant and a kidney transplant done. And he got his wife's kidney. What are the odds of the wife's kidney matching? But he was unfortunately in the process of, he was in chronic lung rejection and dying. So interesting, I was allowed to use Reiki in my practice. I had to call it relaxation technique, but I didn't care. So I went in, long story short, I found out that he was terrified about dying. He said, when you're dead, that's it. And I just knew on some level that needed to change. So I introduced him to a little bit of Reiki. I said, anytime you want to have a session, let me know and I can do it for you. So he'd had multiple surgeries and had a lot of scar tissue, internal scar tissue, which is severe pain. And I went in one day and he was screaming in pain. He was all alone. The wife had gone out. And he said, Sue, do your Reiki do anything? So I did the session. He comes out of it. He says, I don't ever remember feeling this good in my whole life. He said, but I know the pain's going to come back, but it's okay, which said that was emotional pain. Go in the next day. This time the wife's there. She wants to know all about it. So she watches. I've got my hands on his head area and he starts talking. He says, guess what, Sue? He said, I'm no longer afraid to die. He said, I have my whole belief system back. Oh. And the words came right out of my mouth. I said, you know what? I'm stopping smoking. Here you are with someone else's lungs in your chest and you can't breathe. And here I am with my own poisoning my lungs. And I said, it's not about getting cancer, emphysema. It doesn't make sense. It's off balance. I go home that night. 2 girlfriends call. Sue, do you want to go to the Marriott? We're going for hypnosis to stop smoking. And I went and I stopped. I never looked back. That man literally saved my life. Bless his heart.
Wow.
And so that's how I got into hypnosis. And I mean, I still love my Reiki, but the hypnosis is at the top.
That's a very cool story. I love
Yeah.
that. See, this is why we do this, because everyone has a story to tell and they're all very unique and all interesting.
Yeah.
And I love that. So what often prompts people to reach out to you?
Well, a lot of times it's through friends or friends of theirs and my business connections. I'm in 3 fabulous business groups now and starting to get more business. And of course, because of COVID, everything has changed. And I do a lot of my sessions and so forth on Zoom. And I need to be able to reach further out than just this area that I live in. I love networking, but I've been asked twice now from people from England to do cross promoting. Oh, sure, I can do that. And so they realized I don't have the setup to do that. So I just signed up for a fabulous marketing program that takes care of everything. So that's going to be changing. But the people just seem to show up. They find me on Google. They find, and I do a free evaluation for them. And 9 times out of 10, they sign up.
So what is it like conducting your business over Zoom, and how is that received by clients?
Oh, they love it. It's fabulous. And then if all of a sudden they come down with COVID, guess what? They can't come to the house here because I see some people, not many, but occasional people here in my home. I've got lovely space downstairs, but they love it. But then I have no problem with it. So I guess that's catching.
Yeah, no, that's great. They can be anywhere, you can be anywhere, and you can still perform the services to help people. And it's great.
Yeah, I'm loving every minute of it.
That's amazing. So what would you say is the biggest misconception of hypnosis? Because obviously there's a lot, even without asking the question, there's lots of skeptics out there and unsure, don't know what it is. So why don't you explain? I think that'd be helpful.
Biggest misconception that I find is they feel like they're going to lose control, that they'll have no control. Mm-hmm. And after I get through the pre-evaluation, they understand how hypnosis works and how it can benefit them. That's important. Mm-hmm. And the other thing is, are you going to turn me into a chicken? That's a big one. And I say, well, only if you want to. But skeptics are good. And, if someone says I'm a skeptic, I go, oh, good, I love skeptics. Yeah. But if somebody doesn't believe in it, they're not going to call you. They want nothing to do with it. It's okay.
Yeah. How do you find that hypnosis helps people either move on in their life, or like, what do you use it really for?
Oh my goodness. Have you got a couple hours? I have a list of 99 things that hypnosis can help with, and they get a copy of that. But I tell them, if you have all 99, I cannot help you, but if you have 98, I can. So, but I do pre and post-op surgery, and of course, a lot of it's connected with health because I'm a nurse.
Yeah.
I'm using all those years in my background to work with people. And I owned my own temporary nursing agency for 3 years. So I really learned how to interview people. And then doing the triage from home for years, that was learning how to listen. I mean, it's perfect.
That's amazing. So
yeah.
What would you say if someone was starting their health journey today? What would be some tips to give them?
Well, I have a quote that I came up with, and I hope it's on my website. I got to double check. Education is foremost in maintaining one's health. You have to be educated about it. Mm-hmm. And I help them to understand that it's not just your physical health. It's physical, mental, emotional, and spiritual. Those are all connected. One affects the other. And also how they think and feel and the words that they use, all of that I help them to correct. It's up to them. They have to want to make the change. If they don't want to make the changes, nothing's going to work.
No, it's true. I mean, you go through life, I can eat really, really great and look healthy and be healthy. But if I'm stressed, things are going on in my life and they're not going well, that definitely takes an impact. You can eat all you want, but you still might have like stress-induced acid reflux and all these other things that stress affects in your life. And if you don't get that corrected, then you're not living the best you can be. So yeah, it definitely affects, your mind, the way your body works, all these things are interconnected.
And if there's a huge emotional component, that's going to affect their ability to take care of themselves physically. Yeah. I see it all the time. And with this whole COVID thing, you're running into people with phobias now that never had them before, the fear of leaving the house, fear of needles, fear of germs. I mean, the list just goes on and on. And you have isolation.
Yeah.
And then you have the older population. So it gets even worse. They can't get out. They can't do things.
Yeah.
And if they're in an assisted living facility, they're literally prisoners in their own room. I mean, things are better now, but it's been difficult for a lot of different ages.
No, it has. I mean, this was a difficult 2 years, and this is why we started this program, because people like you were doing really amazing things to still help their clients and patients, and all very unique stories. And, and the way that you help people is so different than maybe some traditional medicine, or maybe you go to a hospital and, they're doing everything, run of the mill, and we're interviewing these doctors, and it's incredible to hear all the things that you're doing, all the certifications you have, which led up to this moment of doing what you're doing now to help people. And we think it's incredible. So thank you for sharing your story today.
Oh
And
my goodness, you are welcome. Oh,
giving us so much insight on hypnosis and your story. It's really incredible. So keep on.
I am writing a book. With
You're
those
writing a
stories.
book.
Yeah, the title is Journeys into Hope, Stories of Divine Intervention. And I have about 30 stories now, 4 of which are my own. And
Wow.
it's important. I'm having a good time.
Yeah.
People want to know why I'm not retired. I said, I don't believe in retirement. To me, retiring means going to bed at night.
Yeah. I
So,
love that. Well, you're keeping the spark alive and helping lots of people. And we do really appreciate you telling your story. We're looking forward to seeing that book come through. So keep us posted.
oh, I
And
will,
my
definitely.
last question for you today is, if the people listening want to get a hold of you, please tell us how to do so.
I think right now, at this point, the best way to get a hold of me is my email, sue@monarchhealthcoaching.com, or my business phone, which is 603-882-4944.
Awesome. Well, thank you, Sue, and we hope to have you again.
Thank you, Rachel, very much. Take care.
Take
Have a good
care.
day.
You too.